Hello, everyone. My name is Aimee Strong. I'm a nurse practitioner in thoracic surgery. And to tell you a little bit about where I work and what we're talking about today, we're talking about improving access to care for patients at high risk for lung cancer and using low-dose CT for lung cancer screening. I'm a nurse practitioner out of Centra Medical Group, which is in Lynchburg, Virginia, and it's part of the Allen B. Pearson Regional Cancer Center. So this is a map of the state of Virginia, and just to kind of let you know our catchment area, we are located in Lynchburg, Virginia, which is kind of near the green star in the middle of the map here. And we have a large catchment area. It's this entire area within this blue circle. And just to give you a frame of reference, this is a really large footprint. It's about 9,000 square miles, which is roughly the size of the state of New Jersey. It's very rural. We do have a lot of tobacco growers still in this area. And there is a private hospital system that I work for, which is comprised of 4 hospitals, one in Lynchburg, one at the Red Star near Bedford, Virginia, another hospital down near Prince Edward, which is Farmville, Virginia. Then we have a freestanding ER in Pittsylvania County, which is near Danville, Virginia. So we are spread out. We do have patients that travel from many different areas to get their care here. So what I've done under the umbrella of thoracic surgery is I've built a lung cancer screening program. And we launched this along with many of my colleagues across the country in 2015 after CMS started covering for low-dose CT. And as part of launching this program, I really spent a lot of time traveling around to all of our primary care provider offices within our catchment area. And we have about 60 locations for primary care throughout Central Virginia. So I made a lot of visits to a lot of these sites, talking to them about lung cancer screening, what our program was, how to refer patients to us, what the benefits of doing that are for the providers. I met with a lot of their staff, their nursing staff and referral staff, really just trying to educate people about what lung cancer screening is. And the providers loved it. They were excited over the concept of our lung cancer screening clinic. They thought our referral process was very easy. But what I found over the first several months that our program was live is that we were getting referrals from the central area, kind of where my clinic is located at the cancer center. However, we weren't getting a lot of referrals from these outlying areas. And just to give you a little bit of scale, it's about an hour's drive from Farmville, Virginia to Lynchburg. It's about 50 to 60 minutes to this center down here in Pittsylvania County. And it's about 35 to 45 minutes to get to Bedford. So it's a good hike for patients to come to Lynchburg to see me. And what I heard from our providers is that the patients want to come, but it's too far for them to travel. A lot of them can't afford the gas money or can't afford to take the time off of work to spend a whole day traveling up to Lynchburg to come see me to do lung cancer screening. And then there was a large population of patients who just didn't want to come to the big city of Lynchburg. They were very unfamiliar with the area and it was really stressful for them, so they chose just not to get lung cancer screening. So that was a problem. So we thought, what can we do to improve access for these patients? How can we get them to these lung cancer screening appointments? And our solution was stop making the patients travel to us, let's travel to the patients. So when we looked at our facilities, each of the areas on the map with a red star have a radiology department associated with them that's hospital owned. So this was an easy solution. I approached the PCPs in this area and said, I'm happy to come see your patients if you'll give me space to work. And of course, they were happy to do that because they know that it's hard for their patients to even get to their offices. So they were really happy to have us come down and see patients in their own setting. So some of the challenges that we had to overcome to do this was finding space. We really worked with office managers on looking at their clinic schedules and finding a half a day a month where maybe a provider is not there consistently and letting us slip into those exam rooms during that time frame to see patients. We only go to these locations once a month, so sometimes staff at the locations forget we're coming or forget to tell their patients that we're there and get confused. And there's a lot of staff turnover sometimes. So it was a lot of re-educating staff that we're coming, that we're seeing patients, who we are, just lots of smiling and reintroducing until the staff got familiar with us and remembered that we were coming once a month. It was a little confusing for the radiology departments in these outlying areas because they're not used to me seeing the patient and then getting the scan the same day. So that took a lot of education with the radiology scheduling staff. But what we have found since we've been doing this for a few years now is that the patients love it. Patient satisfaction levels are really high because they're getting care in their own community. They're not having to take a day off of work. They're not having to travel to an unfamiliar city. They're not spending a ton of gas money because some people are driving 50 to 100 miles round trip to come see me in Lynchburg. Now they don't have to use all of that gas money to do that. So the satisfaction levels are really high because we're seeing them in their providers' offices that they already know. The providers love it. I've heard from my referring staff that they feel more engaged with the health system at large because they're located out in these remote sites, and it's hard for them to get into Lynchburg for a lot of provider activities. So they feel like they're more engaged with the larger health system, and it's really helped to build stronger interprofessional collaboration through us because we're seeing these providers face to face now. They'll often grab me and say, hey, I know you're here to see this patient, but let me run this case by you. What do you think I should do about this? So it's really improved access to care for a population with really limited resources who otherwise were not going to get lung cancer screening. So on this slide, it's just a quick overview of our referrals per year. So that first year, we were getting no referrals from these outlying providers at all. And you can see that by year 2, we've increased a good amount. And then at the end of the third year, we had really jumped in referrals from a lot of these referring providers. You'll notice that this line trends down a little bit. There was a big turnover in providers at this practice, so it's taken a lot of re-education to get these numbers back up, but they are up. We're trending again. So this is just my contact information. I'd love to talk to anyone if you wanted to reach out to me, but that's how we improved access to care by taking our road show on the road. Thank you.